about the Sangam and the Sangam of the reality, merging of the reality, merging of the truth. And the truth is, we believe and they believe on the same point, same marker, same concept, that incurable are diseases. No. Curable are diseases. No. It is curability depend that patient is curable or incurable. If the patient is curable, I assure with the homeopathic art, the art of the medicine, the art of the prescribing is bound to cure. When the patient is incurable, whatever may be the name of the disease, starting from cold coryza to the cancer, never cured. Because patient is incurable. This is a concept given by Bernie Siegel in his book, Love, Miracle and Medicine. We homeopathic physicians, I am just making a comparison of a concept where we are merging allopathic and homeopathic physician on the thought. And we do believe that is, and there are many cases of the incurable diseases, like cancer, autoimmune diseases, and many other diseases, is cured by homeopathic medicine. Simple system, simple medicine. No complication, no mixing medicine, no compound medicine by a single medicine. We have got many instances of the cure of these incurable diseases because the physician, prescriber learn by their case proceeding that patient is curable, whatever may be the name of the disease, is incurable for you, not for me. We are searching patient as आज यहाँ इनॉग्रेशन डे में बहुत अच्छी बात कही गई, ज़रा सा हमारे मिस्टेक हो गया था वो ज़बान का कि ये ट्रीटमेंट पेशेंट का करते हैं या डिजीज़ का करते हैं। हम लोग पेशेंट को ही टारगेट करते हैं। आज के केस में आप लोगों से मेरी एक छोटी सी इल्तिजा है कि आप जब हम केस बोलेंगे तो आप अपने माइंड को दो तरफ रखेंगे। एक तरफ जो हम बोल रहे हैं, वेयर इज द पेशेंट एंड वेयर इज द डिजीज, देन आई मेक टू कंफर्मेशन फॉर प्रिस्क्राइबिंग वेयर आई गिव द टू मच स्ट्रेस। इन दिस पर्टिकुलर केस वी हैव गॉट टू फैक्टर, one emotional factor which is very strong in the repertory language, as Dr. Pankaj Acharya is looking his rubric is an element from this emotional factor. How I ignore and how much I have courage to ignore these symptoms, which is very important according to the homeopathic philosophy. What are the reasons behind it? This is also we learn from this case. My simple suggestion to all youngest homeopathic would be physician, my seniors, my colleagues and friends, that it is the art of the case taking who developed the art of the homeopathic prescribing. If our art of the case taking is not fully on the level of the perceiving, art of prescribing is not going to be developed. Before reaching to the art of prescribing, we need good perceiving case. Perceiving means your case should be filtered by your five senses. This is perceiving of the case. Another thing which I am going to add here is something is intuition. That is sixth sense. I have got no such criteria to develop, which I like to share with you regarding how intuition developed in homeopathic prescribing. But I can say that there are many prescribing have an outcome of the perfect intuitions. And this is going to be gradually developed when your art of case taking is going to be very matured. In this case too. So, whenever we are going to take the case, this is case taking in one part, case perceiving is another part. In case perceiving, our target should learn to perceive simply the human being. Among human, I mostly consider being. Here definition related to the self. We are searching self. We prescribe for self. Because the self first sick, then the administration of the sickness is going to be produced either systemic or organic. My friend, whenever we are going to taking a case, there is a one part, and the part is very important, but we ignore this particular part. And this particular part will taught us regarding case is incurable or case is curable, which I like to share. Then after that I am going to discuss this case. When the patient having the history of male, his father and mother side, first thing we like to watch, the family tree should be very potent, powerful and good length of the age and poor pathological diseases. This is one of the very strong criteria to learn about the patient's curability. If you have got in the history, father and mother and their families having a good age, 75, 80 like that, death due to the old age, no such strong pathology like cancer, tuberculosis, etc., etc. This is one criteria. Another area to just watch that patient is curable or not is going to be expressed by the individual symptom. This individual symptom should be a red line symptom in the case perceiving. Patient's desire, aversion, disagreement, as well as dominating mental symptom, which is going to be expressed by the body language. Should be persistent one. We learn in our case perceiving only factor which is going to be persist in the case perceiving. Fluctuating symptom have got no importance in our totality of the symptom. It is a symptom which is going to be stick in the human personality, bound to stick in our totality of the symptom. This is the important criteria of learning totality of the symptom. We search the symptom which is going to be stitched with the patient. After repeated query, questioning, you did not find that patient is going to be थोड़ा सा भी उससे खिसक जाता है, थोड़ा सा भी उसके सिम्टम में फ्लेक्सिबिलिटी आती है. No, just fixed, and that fixed symptom should be fixed in your totality of prescribing. By these criteria, we came to an end stage of the case perceiving. We decide that patient is curable or not. Third stage. Third stage is the lifestyle. In the lifestyle, if the horror of the stress is very, very minimum, tolerable and expressive, then this is a good indication. When the patient said regarding their stresses having a capacity of coping, is a worst case for homeopathic prescribing. Means the patient is more towards the introversions. no expression, only intonation. This feeling of inside, keeping inside, making the whole pollution of your personality, especially in the level of the self, especially in the level of not human, rather in the level of the being. We as a physician target all these things. Then we conclude that patient is curable or incurable. When you decide the patient is curable, it's good. The symptom which you have, if you have not able to select the medicine, consult your senior. Give proper dose, proper medicine, proper interval, and wait and watch. This wait and watch is a very, very important factor in homeopathic practice. As our president is talking about the placebo. In fact, the outside the homeopathic system of medicine, they does not know about the beauty of placebo. Means to please what patient needs. Needs please. Either you please by placebo or you please by the homeopathic medicine. Question of please is very, very important in our case procedure. Now, I like to discuss this case. This is first, I am just going to say about that. First, I like to say something about immunity, or we have got many slides. I just not like to. Durability is one side, and the beauty of homeopathy is one side. First, you decide yourself where you like to stay. Stay with the confidence. We need confidence. Confidence in the learning, confidence in the practice, confidence with the sharing of your knowledge to all your system of medicines. My friend, auto means self. हमारे अंदर एक शक्ति है, एक पावर है, जो मुझको अलाइव रखता है with the understanding of environment and the surroundings. This is failure of or misunderstanding of self, myself, with the environment, and pathology is going to add with the genes and genes, etc. Genes is nothing but the susceptibility of the attracting diseases. Genetic diseases, this and that, many more things. We learn for the case perceiving, case taking is good. But when you are going to a stage of prescribing, all these things have got least importance. Otherwise you are going to be frightened and you not able to prescribe a good remedy, perfect remedy. Your anxiety of pathology, your anxiety of incurability of the case, your anxiety about the knowledge of the practice of medicine, make yourself shaky. This shakiness make you a shaky prescribing. Result is shaky. We need confidence. And our confidence is our homeopathic philosophy. We as an empiric physician, we are the empiric physician. We are going to follow the footsteps of our seniors, forefathers, post-Hahnemannian stalwarts. They are our confidence. Homeopathic, without the understanding of the empiric concept, empiric physicians believe